should be the same.
Yeah.
I just figured out the back. I'm just gonna leave it sitting up there. Okay, just switched.
Check, check. But I'm pretty new into the series. Yeah. Excuse my feet, bro.
everyone. Squeeze on in here if you can. We're going to go ahead and get started. Thank you all for coming this morning. What a truly historic day for Citizens Health and Citizens Medical Center. We have an excellent group of people here that have gathered together for a pretty special and important event, a groundbreaking ceremony for a new medical campus for the hospital and for the citizens of Colby and the people of the region of Northwest Kansas. So very glad that you could all join us today. I want to take a moment to recognize some of the founders of this organization. Citizens Medical Center was incorporated in 1979 by a group of forward-thinking individuals who set to put us on the path that we're on today. So members of that group were Larry Barrett, Lester Barrett, Lavesta Binder, Kenny Crampton, James Firestone, Sheila Fromm, Steve Frazier, Warren Hills, Roberta Hornung, Judy Kissler, James McGinnis, Robert Page, Rodney Ryan, Wilma Sloan, Dr. Floyd Smith, Phoebe Stone, Marilyn Surmeyer, Jim Tubbs, Isla Lee Weiland, and Don Woofter. So a big thank you to that group of individuals. You know, our organization and community are forever indebted to those who set to put this in motion. And here we are today. 40 years ago, the hospital over here was built, and you know, here we are 40 years later, preparing for the future of healthcare in Colby and in Northwest Kansas, and such an important event for us to be able to establish what the future of healthcare looks like for the region. So today, in support with the Board of Trustees, a talented medical staff, and associates who work for the organization, you know, we're proud that we're going to start this next chapter. So thank you all for being here, and welcome. Up next, we have the Colby High School Choir, who's going to be singing our national anthem. Come on up.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Please remain standing. I'm gonna invite Greg Unruh, a mentor, a friend of mine, to the stage now to do an invocation.
Very special good morning to each of you. Glad you're here. This is a joyful day. We're very blessed to be here, and we're very happy that you're here. And at this time, I would invite you just to hear an invocation of thanksgiving. Eternal God, we are richly blessed as today we celebrate the beginning of a new medical campus for Citizens Health. God, we know that you are a gracious and loving God, and today we see your goodness. We're richly blessed with the people of Citizens Health. We have a dedicated and committed board of trustees. We have a superb and talented community of medical providers, and we have a highly compassionate workforce. And we're grateful for this opportunity to serve the healthcare needs of our patients that depend on our people for their well-being. Thank you for this opportunity to build our new medical campus. We know this project takes a lot of people working together in the goal of creating the right space for serving patients. Thank you to Health Facilities Group and their design and architectural team. Thank you to McCarthy Construction and the teams necessary to actually build the facility. Thank you for the two financing organizations, USDA Rural Development and Stroudwater GCL. That makes the project possible. And Lord, we are just grateful for your love. Now we ask your continued blessing on our building project, and we ask your blessing on our work in enhancing the lives of the people we serve. Amen.
Thank you, Greg. That was great. So I want to take a minute to recognize a couple of special guests that we have with us today. Senator Rick Billinger is here with us today, so thank you to Senator Billinger for being here. Macy Spears with Stroudwater GCL, as Greg mentioned, part of our financing partners, so very glad that she could come and be in attendance today. HFG and McCarthy, you know, we've been working on this for quite a while, so very glad to have the strong partners that we have in this building project. The hours and time and dedication that they put into it is really important. So a special thank you to those people for being here today. Up next, it's my pleasure to introduce Bob Standage, Chairman of the Board of Trustees, to say a few comments.
So, you know, I was contemplating what I was going to say yesterday when Curtis called and wanted an interview for the radio to kind of promote, you know, the groundbreaking ceremony, and so pulled together a few thoughts just to share with you. As been mentioned before, you know, our current facility is 4 years old. We have some goals to meet the future demands, if my notes don't blow away, in an efficient, cost-effective, flexible manner. Also provide quality health care close to home, and that's always been one of our kind of founding cornerstones of our work. Enhancing the lives of those we serve and bringing services of the hospital and clinic under one roof for convenient access to care. So the new facility will have that. We're going to accomplish that goal with the new facility. Just kind of as a reminder, and most of you know, Citizens Health is a community-owned, not-for-profit healthcare system, and encompasses, you know, the clinic, the nursing home, as well as the hospital. We're very, very blessed to have a robust group of medical providers. We have 8 physicians, general surgeon, orthopedic surgeon. We have 9 nurse practitioners, 7 physician assistants, and a social worker. We have 5 CNRAs and 42 specialists that provide care through the organization that we currently have. So we're very, very fortunate in that regard. Just a couple other things to share as well. In 2020, our workforce came from 42 different zip codes in our region. So that spreads. We have people coming from a long ways to help provide care here. And the annual salary for that payroll was just a little over $23 million of economic impact to the region that's provided by this facility as well. We are the only healthcare facility along I-7 between Denver and Quinter that has an OB program. Most of the rest of them have no longer deliver babies. So as a result of that, the demands upon our staff and upon the facility have grown considerably. Our patient base has increased 65% over the last 5 years, and we're still trying to get all that done in the cramped spaces that we have. One other thing that's kind of significant is over half of our patients come from outside of Thomas County. So we're not just taking care of your neighbors, we're taking care of your cousins and the other folks that are a little further down the road. Funding for the project is going to be through USDA, a low interest rate loan, and it does not directly impact local tax dollars. So we're very fortunate for that. Might publicly thank Jerry Moran for helping us get that loan application to the finish line. That was quite a process. Just a few other things. The site, the size of the facility as this was being designed with the help of our architectural team, it's a data-driven design. We just didn't go out and pull numbers out of the air. We went and actually did the homework, did the hard work to figure out, okay, what kind and what size of facility is appropriate for the region and for the area that we're going to try to serve. It's going to be roughly 175,000 square feet. It'll still remain a 25-bed critical access facility, but a lot of our growth over the last year has come in the ancillary areas where not necessarily in healthcare has changed, where people aren't in bed near as much as we have outpatient activities. So time frame to build the thing's about 2.5 years. Our existing facilities will be repurposed in other ways to support the main activities of the facility. So you're not going to see a bulldozer out here bulldozing down the existing facility. You're going to see those turned into other support areas that we need to help the existing model. So with that, I want to thank the community leaders that had the foresight, and David kind of did this earlier, to form the not-for-profit community hospital back in the late 79 and early 80s. Their foresight has provided us the opportunity to continue to grow and to get us to where we are today. So with that, welcome, watch us grow, help support us. The only way this thing works is you guys continue to support the organization, and we'll do the best we can to provide quality care for you as we go. So thank you very much.
Very well said. Thank you, Bob. Up next, I'd like to invite Dan Fisher. He's with the USDA, and without the USDA, none of us would be here today. So we've been through an application process, and I'm very happy to invite Dan Fisher to say a few words.
Thank you, David. And on behalf of the USDA Rural Development, it is a great pleasure to be here. I'm filling in for our State Director, Christy Davis, that is a little bit under the weather still from an emergency surgery that she had a couple weeks ago. So, but she sends her regards and would really like to have been here if she could have. But as Bob mentioned, this is a great facility that you guys are looking to do. I mean, it is going to take the community support, so it is great to see the crowd that we have today showing that support for that, as he mentioned also, because it is through a long-term loan of $86 million that USDA put in their direct funds. Plus, as David mentioned also, Macy Spears with Stroudwater have helped out that with a $21.5 million guaranteed loan as well. So there is a sizable investment going into this community, and plus the applicant contribution that the board trustees on your part has also put into this as well. So from that side of things, I mean, it is great to be here. As I mentioned, it has been a long time coming, and we apologize for that on the rural development side. But when you do deal with this size of project and getting all the things in order, it just takes a little bit longer. And again, Congressman or Senator Moran, thank you so much for your help in getting this, the funding through USDA Rural Development from the political side of things too. So with that, like I said, I mean, it's a pleasure to be here, and I look forward to, I know that I grew up 60 miles southwest of here, so I've got aunts and uncles that come up and use the current facility. And as a young child, I actually came up and had a surgery here, or some stitches put in at one time as well too. So to know that what the new facility is going to be so much better efficient run and things like that as well. But again, thanks to all the partners that have been mentioned before, HFG, the architects, to be able to lay out that is great as well. But again, thank you all for being here, and we look forward to being back for the opening ceremony and cutting the ribbons. So thank you.
Thank you, Dan. Up next, Health Facilities Group. Their corporate headquarters are in Wichita. They're the leading healthcare architect team for Kansas. HFG has been a leader in Kansas healthcare architecture for a long time. We're proud to have them as a partner. Very proud to have them here with us today. They've been with us for a long time, and very happy to have their team. I'd like to introduce Larry Crane, the lead project architect, and a friend of mine now. As we progress through this, we've had to get in the weeds on stuff, so very, very happy to have Larry here to say a few words for us.
Glad to see everybody. 2 minutes for me is usually pretty tough, so we'll see how this goes. My colleagues up front definitely can attend to that. And then first and foremost, I want to just thank everybody here in the community, Citizens Health, the board, for the opportunity. We understand at HFG and its entire design team the monumental task that it took to get this far, and the importance that it's going to gain to the region, not just the city, the region. So we are very excited to be here. So some of the design partners are across 3 states and beyond. So HFG, as you mentioned, was Wichita. I'm out of Kansas City. Ferris Engineering is out of the Omaha office, and there's 2 offices. They're doing mechanical, electrical, plumbing. BHC, which is civil engineer. I know Mike is close here too, from Kansas City. Apex Structural Engineering is out of Sioux Falls, South Dakota. I brought them down here. Great guys. Get the chance to meet them soon. Dan Millis is the kitchen consultant. He's out of Ohio. And McCarthy Equipment. They're all over the place. But without all the team coming together to do this, again, we all thank you for the opportunity. It is not overlooked by our team. A couple of things though. Relationships and design are really our founding of what we believe in. And why we do get excited about that. First and foremost, it's the relationship building that we create. We create spaces as architects and designers. The construction team actually builds it. That partnership is this one level of that relationship. The relationship that the healthcare delivers, and that through those spaces and the opportunities is just chokes me up. So it's something that we as a company just know. And the hours that we invest with you, we get to know you personally. And what we do is very personal. And so it just comes out at times. But something else. So anyway, there goes my 2 minutes. The opportunity with the relationship that Tim Duke, principal at HFG, and Greg Andrew have established over the years got us to this point. And Tim couldn't be here today, but his family is, so it's really important. Sorry. Kindred spirits is where it all lies. So that we come from Kansas City or Omaha or somewhere else, we all are kindred spirits in delivering quality healthcare. The meaning of what we do, again, bubbles over. The other stuff, design. Architects love to talk about design. And that stuff is really clear. The emotion part of that is just in your faces when we do a good job. We are committed to do that good job. The study that was started to expand the existing facility, it's a 40 years old facility. It's been incredible, and it's getting to a point that it needs its next life. So that the comments about repurposing that facility, and it has great opportunities. The new facility is answering all the regional goals, all of the recruitment, all the staff retention, and it's all grounded in the ideas of we're going to do it right. Make the commitment to do it right, short term and long term. Again, follow in the footsteps of the people that started the organization back in the 70s and 80s. So briefly, departments that are growing. One of my people that Amy over here, I asked her, what departments are really growing, how much? She goes, all of them. All of the departments are growing. And you kind of think about it for a minute, it's like, well, why is that? Well, it was alluded to, but the real factor is that the data analytics show the need for this facility is something that is 2, 3, even 4 times the size of the current facility. And that doesn't mean that's a wish in a pie in the sky. That's the facts. And in the future, you're going to hire more doctors, you're going to get more staff, people are going to want to live here, and that's your healthcare system is one of those key foundation things, just like schools. And you have a great system between the college and the high school. So you have everything going for you. And there's my 4 minutes. All right. Long and short of this, again, very, very happy and emotional about the opportunity. Can't wait for the tours and see everybody enjoy this facility come out of the ground. It's starting very soon. So with that, thank you again, and I'll let you go.
Thanks, Larry. Up next, I want to invite Ryan Saywall up to say a few comments. Ryan Saywall is Senior Vice President with McCarthy Building Companies. And early on in this process, we sat down and looked at some construction companies to be able to aid us with this. And, you know, McCarthy has stood out as a leader in healthcare construction. And so very happy to have them as a partner, very happy to have Ryan here today. Their team has been phenomenal in working with us, and you know, we're looking forward to the next phase to see what McCarthy can really do on the ground. So thanks, Ryan.
What an exciting day. This is awesome. Excuse me. On behalf of McCarthy Building Companies, we're excited to help celebrate the groundbreaking of this amazing new facility with everyone here today. We first were introduced to Citizens Health back in 2019. That's over 3 years ago. And after getting a tour of the facility and meeting with several of the staff members and team, I immediately knew this place, this hospital, was special. It wasn't special because of the facility or the technology that you were using, but because of the people. I was immediately drawn into what the leadership team's vision was for this community and excited to help make an impact. Much like healthcare, the current economic climate for the construction industry has been very challenging. We've had challenges with supply chain, challenges with inflation, challenges with staffing shortages. Over the last 2 years, we've been working closely with the leadership team at Citizens Health and our design partners to find solutions to these challenges. I'm excited to share that we have a few partners that we recently added to the team. Rand Construction for mechanical and Bart's Electric have been added to our project team to help enhance our delivery and the selection of our critical infrastructure for the hospital. Along with our entire team, these partners are dedicated to the mission of Citizens Health and are excited about engaging the local community in this journey we're going to take together. Speaking of local businesses, isn't this equipment awesome from SCORE Land Development? It's pretty amazing. This local contractor from Oakley, Kansas is excited and ready to get going here very soon on this project. This is a great day for the residents of Colby and the surrounding communities who depend on quality health care for themselves and their families. As one of the nation's largest healthcare builders of hospital facilities, McCarthy is honored to be involved in this project, and we're excited to make an impact in this community for generations to come. Thank you.
Thank you, Ryan. Up next, I'd like to invite Senator Moran up. What a very special guest we have with us today. Senator Moran has been serving in the Kansas Senate, or served in the Kansas Senate from 1987 to 1997, and was elected to the House U.S. House of Representatives, and served 7 terms in the House. He was elected to the U.S. Senate in 2010, and re-elected in 2016. And next week will be re-elected. So very happy to have Senator Moran, a special friend to us, to rural Kansas, and to healthcare. He's especially friendly for all of those. Very happy to have him here today. Thanks for all your help.
Thank you.
It's a habit to say, well, that's like the best introduction I've ever had. There was a portion of that was really a nice part of an introduction. And I worked so hard to be nonpartisan, non-political, that particularly this kind of setting. I'm glad that you said those political things, and it's not going to come from me. I was met by Greg Unruh as I arrived, and he showed me the program. And he works his way down the list of people here, these distinguished folks who've spoken, and he gets to my name, and he wants to point out that I'm keynoting. I don't know what about minutes, Larry, what keynoting means, but I can tell you that then David took me aside to say, you have about 2 minutes. So, keynoting is irrelevant in at least the amount of time that you're expected to use. But I can tell you from serving in the United States Senate that not many of my colleagues ever abide by any of those kind of rules. But this is, as has been said, a very special day, and I commend this community. I commend its leadership. I'm pleased that to have gotten acquainted with David as he arrived in Colby. Greg and I have known each other at a number of hospitals across Kansas, Onega and Scott City. I have visited every hospital in our state numerous times, and I've been a patient as well at this hospital, traveling down the road and having kidney stones. So I'm pleased. I don't want to meet the specialist today in kidney stones before I depart. This is evidence that this community has determined that it wants to have a bright future. This could be just about taking care of yourselves, but I'm not sure that's what you'd do if you were just self-interested. The decisions that have been made by your board, by this community, are long-term decisions, similar to the ones made in 1982, that we're going to create something that lasts a long time. Our ancestors settled these challenging plains of Kansas a long time ago, and if they only looked after themselves, it's unlikely that any of us would be here today. Kansans have lots of attributes that make us special, but stick-to-itiveness, thinking about our children, our grandchildren, our future, investing in a community, saying that we want something special here. And you could say that just this is going to be a great facility, a great building. It looks good. When you come to Colby, you will have this reaction, oh my gosh, look at their hospital. They must have something going for them. But the reality is this is much more than appearances. And ultimately, this is whether or not people's lives are improved and whether or not people's lives are saved. This is one of the most important investments. I was here last week. I'm missing Colby. I was here last Wednesday, breaking ground. It's a bit more windy today than it was when we were at Colby Community College, and I would ask who's ever using a shovel today to really not throw the dirt up in the air. Let's just pretend that we're breaking ground. But the reality is this place will matter for years to come, and it means that people will have quality health care. And it takes a facility today to attract a physician, to attract healthcare workers, to attract patients. It can't be the 1954 Hill-Burton Hospital that is in so many communities across our state. And so this is the moment in which the long work and effort brings us to the day of more long work and more effort. But even when you cut the ribbon, and even when patients are being served in that new facility, it's just long, hard days and more work to make sure that what you are investing in met its purpose. Lives saved, people better off, healthier, and serving a community of Northwest Kansas that needs your help. I commend the folks who work at Citizens Medical in all capacities. We know after what we've been through in the last several years, it takes real determination, stick-to-itiveness,
a sacrifice that says other people are more important than me. I don't think anybody enters the healthcare profession unless they believe that who they're caring for is more important than them. So awfully good things are going to continue to happen in Northwest Kansas because your ancestors, your leaders today, and your leaders tomorrow decided that this is a place worth investing in. I get to see people from all across the country these days. I just would tell you that there's no place like home. There is no place that has this kind of attitude and approach to life. And you ought to be very proud of today, and we'll be back to be proud of tomorrow with you as well. Thank you for allowing me to keynote this second event today. We're honored to be with you.
Thank you, Senator Moran. Okay, up next, we're going to conduct the ceremonial groundbreaking. So I would invite Senator Moran, our Board of Trustees, Bob Standage, Lon Prom, Janet Sadler, Janine Brown, Jennifer Schoenfeld, and Eileen Levenstein up here, as well as Dr. Matchell, our Chief of Staff, USDA Dan Fisher, Larry Crane, and Ryan Sawala to do a groundbreaking ceremony with us, as well as Ryan and Jenny. There we go. You two got to get up here too. All right. Thank you.
Thanks for letting me join. I don't know if I should do this one. That's like
Here's your photographer right here. She's the one you're looking at. Greg, get in there a little more. Okay, look. All right, 1, 2, 3. One more.
Fall off the chair.
I'm in a good place.
Yeah.
1, 2, 3. Good. Thank you.
Good? So, on behalf of the staff and the Board of Trustees and the providers, we really want to thank you for turning out in your community to help us grow and further develop a healthcare system for Northwest Kansas. So we appreciate you coming. Keep an eye on us as this facility grows, and we'll have a ribbon cutting at some point in the future. So we welcome you to come back then. Thanks very much.
Yeah, there are refreshments and water in the back, so please go ahead and help yourself.
See what he's playing, so he's going to run the show this afternoon.